Hi, I'm Dr. Abby Bleistein. I'm the medical director of Healthful Life MD, which is a multidisciplinary approach practice for medical weight loss. I'm a physician. I'm board certified in internal medicine and pediatrics, and also board certified in obesity medicine. And I specialize in this area. A lot of patients come to me wondering, what is medical weight loss? What does that mean? And as you know, there's all kinds of ways to lose weight, right? We see advertisements all over the place. There are books that come out every single day about how can I lose weight. But medical weight loss is really approaching weight loss from a scientific perspective. And what we try to accomplish is using a multidisciplinary team to help patients not just lose weight, but keep that weight off. We work towards sustainable lifestyle change. So at Healthful Life MD, my goal isn't just to help you lose weight, but to really become more healthy. It's important that you're healthier at the end of a program than you are at the beginning. So we do that with a multidisciplinary team approach. I see every patient for a complete medical history and physical, so we can look at the medical problems that might be affecting you. Many of my patients have high cholesterol, they have hypertension, they might have reflux, sleep apnea. They might need to go in for surgery where they have arthritis of their hips or knees and need joint replacement and are not at a healthy weight for that to be successful. So lots of medical conditions that may be contributing to their weight or from their weight. I do the complete history. We also talk about what's worked before and what hasn't worked before. So most of my patients have tried many, many programs before they come to me and find that maybe they're variously successful, but they have difficulty keeping that weight off. And so the goal is really, can we help them not just lose that weight, but keep it off? And then I partner my patients with a registered dietitian or with our certified nutritionist to work not just on the nutritional piece. A lot of my patients are very educated about nutrition and have read all the books and have done a lot of different programs, but to really help hone in what works and what doesn't work. We use the latest research and really think about nutrition from a scientific perspective, and we can sort of weed out the wheat from the chaff, right? So figure out what's the real information, how can we help patients with their nutrition and optimize it. But they can also help patients with behavioral issues. So some of my patients have sleep problems that they've been struggling with, or they have difficulty managing stress. And so their eating changes when they're under more stress, particularly, in pandemic times or around work-related stress. A lot of my patients travel quite a bit for their job. So stress is a key thing to try and figure out, how do we eat around those things? How do I eat when I'm traveling? How do I manage nutrition around work and work schedule or work events? So the dietitian and the nutritionist can really help to work individually with each patient to address their specific needs and what's impacting their ability to be successful. I also partner my patients with a trainer. And a lot of patients, they may find, well, I can exercise, they'll tell me that, or I am exercising. But working with a trainer does more than just that, exercise piece of doing it, but doing it in a way that's effective and efficient, right? A lot of us don't have a lot of time to put towards exercise. So we want to make sure that what we're doing is giving us the maximal benefit for the time that we're putting in. Some of my patients have had trouble with past injury or chronic pain, and working with a trainer who understands these things and can help bring them back from those injuries and get beyond the pain, really reduce their pain so that they're able to be more active. So it really helps to see a trainer in that way so that they can give you that specialized attention that you need to get back to doing the things that you love to do in a way that's safe and fun. So I partner people with that trainer. And then we also partner people with a psychologist. And the psychologist can specialize in various aspects. I have a psychologist who actually specializes in working with people with chronic medical conditions. Many of my patients who carry extra weight have chronic medical conditions that either are a result of or impacted their weight gain. And really learning to manage and live with those conditions can be helpful. So working with a health psychologist who specializes in that has been key to my patient success. I have a psychologist who specializes in sleep issues. A lot of my patients have sleep problems or decreased sleep, and that really impacts health, and it also impacts weight gain. So we know that as people gain weight, they're more prone to problems like sleep apnea. But in fact, sleep apnea itself or insomnia can lead to weight gain as well. And so working with a specialist to get those sleep issues under control can make a big difference in their long-term health and success. I have a specialist who specializes in eating issues and relationship with food issues. Some of my patients have significant issues such as binge eating disorder. Some patients struggle with problems with just stress eating, and they find emotional eating is a real problem. So working with someone one-on-one to really specifically individually address those issues with my patients helps them to be successful. We also have a chef with the program who can help people to cook and eat real food, as I like to say. I think a lot of times we are rushed for time, and it's difficult to do meal planning or food prep. So working with someone who can help make that process easier and can make healthy food really delicious and enjoyable using the kinds of foods that we like to eat, whether it's culturally, that there are certain foods that we remember from our childhood that we want to continue eating but may not be healthy, the way they're made, and capturing those flavors, or just the kinds of flavors and things that we enjoy eating. And the chef can be really helpful with that. So a medical weight loss program, we look at all of these aspects, from the medical conditions, medications that might support change, working on decreasing risk from health conditions such as hypertension, diabetes, cholesterol, making adjustments in those medications as you lose weight and as you get healthier. Working with a dietitian to really hone in that nutritional piece, working with a trainer, working with a psychologist, working with a chef. All those things really help patients to be successful versus a program that might focus specifically on calorie reduction, which probably is not going to be helpful long-term. Or specifically work on only exercise, which is not going to be successful long-term. So if we combine all of these aspects of care in a comprehensive medical weight loss program, we find that patients are successful, not just in their weight loss, but successful in getting healthy and living better lives. So thank you so much for listening. If you want more information about our comprehensive medical weight loss program, you can go to healthfullifemd.com and you can meet our team there. You can even schedule a free phone consultation with me. I'd love to talk to you more about what your challenges have been and see how we might be able to help. Take care.